So yes, your professional development paper is due next Sunday on the 16th.
Prof, you say what time is the exam review again?
The exam review is Sunday at 8 p.m. Eastern.
Thank you.
Yes, ma'am. All right, let me fix the. I'm just checking both sections to make sure everything is correct. All right. So again, your professional development paper is due at the end of week 6. Exam 2 is next Friday. Your live review is Sunday at 8 p.m. Eastern. Week 7, we have quiz 4. Week 8 is you'll have your next set of NCLEX questions, and then your NCSBN position paper is due in week 8. Week 9 is quiz 5. Week 10 will be exam 3. And then, of course, week 11, you will have your HESI leadership, and then week 12. So week 12, remember that we are going to meet on Monday. Is Monday still a good day for everybody? Okay, all right, we got some head nods. Okay, so great. So just make sure you get your assignments turned in. Homework grades will get turned on next week too, so that you'll be able to see that how it impacts your KGA, and then they'll get turned off in week 8. So you'll get your next exam in there.
Did you say Monday for week 12?
Yes.
We have lab and mental health on week 12.
Okay. So let's look. Even you still have lab in week 12. What time is your
lab is from like 9 to like 12.
We won't have lab
week 12.
We'll
We
just
won't have
online.
lab.
We just have online class. You just have to go in attendance, but you don't have to. It's just a quick login and log out for attendance and evaluation.
So what time would that be?
What time is your mental health?
It's at 2.
It's at 2, so 2 to 2:30. So would 2:30 be fine? So you guys can just log off of mental health and then log into leadership?
I really don't know what her plans are week 12. So I know that class usually runs from 2 to 4:30. So I guess whenever we get off from her, then we log on with you, I guess. I don't know.
So week 12 is just the check-in.
Okay, so do you want us to log in at like 1 with you?
Would you like to I want to try to make this as easy as convenient as possible. What time is your mental health class? As you said, it's at 2?
Yeah.
I can do 1 o'clock. That's absolutely fine.
1 o'clock works for me. I'll be there.
It's fine for me.
1 o'clock works for me too.
So that's a pretty good general consensus. Okay, so we will do so 205 would be Monday at 1 p.m. Eastern. I just gotta write the date down so I don't forget.
Is that the 22nd?
Whereas
It
my,
is. It's
okay.
it's the 22nd. And I'll post it in the announcements. I'm writing it down so we have it. So we'll do Monday at 1 p.m. Eastern. All right, for our attendance for week 12. All right, and like I said, I'll post it in the attendance or in the announcements so that we don't all forget. So that we can meet that last week so you can get your attendance for week 12. All right, so just make sure, no questions about the professional development paper, no questions about the NCSBN paper right now. I know the first one's gonna be the professional development paper. So you don't think of any questions right now. If you have questions later on as you're getting ready to do it, feel free to call me, text me, email me, whichever, so that I can just make sure that you guys are all on the right. And so we are all on the right page and get that done. So today we have chapter 17. Chapter 17 is all about collaboration, leadership, leading and managing. So with that being said, as LPNs, as future LPNs, developing your leadership skills, your management skills, are important. You will direct, you will supervise others, within your organizations. And so, I think we probably talked about this in week 1, but there's leadership opportunities as LPNs, right? As nurse managers, as charge nurses. I've seen assistant director of nurses. I've seen LPNs as directors in assisted living facilities. So you must, you developing those leadership and managing role or skills so that you can, properly supervise your, unassisted licensed or what is it, unlicensed assisted personnel, and maybe even other LPNs. So who has heard of a mission statement? What's a mission statement?
A mission statement is something that describes the quality and the importance of the business, like a standard is something that they put out there to catch your attention about their particular business.
Okay, very good.
It's also
Part
something
of-
that, like, when people get hired somewhere, or say loved ones go to a nursing home and they're trying to look for somewhere for their loved one to stay, is their mission statement. It's like a promise of like um what they will provide or what is their motive.
Okay,
Mhm.
okay. Somebody else
So-
wanted to say, go
So
ahead.
like their business core values, the business core values.
Right. So it's the purpose, it's the goals, it's the values, it's the culture, it's the norms of that organization, right? And so some of the topics that we may see within a vision statement could be, their customer service goals, respect, honesty, client-centered care, right? Cost-effective care, safe care. And so that mission statement is really important. In a lot of places, when you apply for your positions, anybody ever had an interview where they say, what made you apply here? Or why do you want to work for us? Has anybody ever had that question in an interview? Or they'll ask, how does your values fit in with our mission statement? That's another one. So when you're applying for positions and you're looking at things, look at their mission statements, and read them and see how it aligns with you and your goals. And that's also, something important, because when you do go work for an organization, they're going to expect you to know what their mission statement is and how you can continue and or fit in with that and continue and help them to achieve those goals. With that, it's just an interesting, everybody's, mission statements and goals of the organizations. For the most part, most goals of all organizations are the same, right? To provide that safe, effective care, but they want people that are going to work with them to achieve that goal. And then we go into that Nurse Practice Act. And again, know your nurse, I can't reiterate this enough, but know your state's current Nurse Practice Act. That will define your role, that will define your boundaries, what you can do, what you cannot do. And that will keep you safe as long as you work within those boundaries. So I forgot what I was going to say. The next part of the organization would be an organizational chart. Has anybody ever seen their org chart at their employer to know where you fall within your organizational chart? Has anyone ever seen one? So I'm going to share my screen so we can look at the PowerPoint. So this is just an example of an org chart, okay? Most of them are going to be a lot more, there's going to be a lot more people. So for example, this one has the owner of the nursing home. The owner of the nursing home can be an individual, it can be an organization. You have the board of directors, and then underneath that, you have all the different departments or the different parts. So OT, dietary, physical therapy, nursing, maintenance, social services, secretarial activities, and then under nursing. And then for each one of these different departments, all of the employees will be listed under there. So if there's a manager here, the manager will be listed first, and then all of the occupational therapists or therapy assistants will be listed there. And then again for each one. Okay, so for nursing, the director of nursing, the nurse manager, the charge nurse, nursing assistants, and then all of you or all of the nurses, all of the RNs, LPNs, nursing assistants will all be listed on there. So what is important to just looking at this? Why is knowing this important? Why is it important to know what your
Chain of
organizational
command.
chart looks like? Say that again.
Chain of command.
Chain of command, absolutely, right? So you know who to go to when you have an issue with whether it's in your department or it's in another department, right? So maybe you have, a physical therapy assistant or a physical therapist that, I don't know, is underperform. I don't know. And you need to talk to their supervisor, right? That information would be here for you to go talk to them. Who's in maintenance? Something breaks on the unit. What do I do? Who do I call? Right? So you have these. And it's important to understand where you fall as well. Because if your name and there's one of these little marks that go down and there's people under you, that means that you're directly responsible for them as their supervisor, right? So knowing where you fall on your organizational chart. Depending on the size of the organization, this could be a couple pages long, right? It could be much bigger. So it really just depends. Like I would, think of like a hospital system with all the different departments and all the different units. Each unit has its own unit manager, right? And then their staff underneath that. So again, it's just super important to kind of just understand where you fall So this is, you know, just another example as well. So you as a LPN, as a future LPN, sorry, you will be supervising unassisted licensed personnel. So CNAs, care partners, trying to think of all the different terms that they use. But you will supervise the care, and you will be required to direct and guide and supervise them, as they provide this care to your clients. So what are some skills that, and I'm leaving it on this slide, but what are some skills that you will need to function as a manager? What are some things that you feel that you will need to have in order to function as a manager?
Critical
Be,
thinking skills.
give
Leadership
constructive
skills,
criticism.
Okay. Constructive criticism, critical thinking skills. What else?
leadership,
Okay, leadership. What else? Think of something.
maybe take some classes for conflict resolutions, so you know how to deal when you have an employee that's not happy and
That's a very good one. Conflict resolution skills. Absolutely. What else?
The ability to work well with others and being able to teach.
Okay, that's a good one. Being able to work with others, being able to teach and guide. Absolutely.
and feeling comfortable with delegation.
And comfortable with delegation.
Also organization, like if like you have to do disciplinary actions, you want to have like an order of things, and like you want to be organized so everything is not all over the place, or 1 month is something, the next minute rules change. Like, so I would definitely say organization as a manager is something you would need to have.
Absolutely. Absolutely. Those are all awesome. So yes. So basic nursing skills is one, right? So we have to be confident and comfortable with our skills. And someone said be able to teach, right? So we may actually have to teach or guide others when doing their skills. Maybe, you know, everybody has some shortcuts that we learn over time. Some shortcuts are okay, some not so good. Time management skills, absolutely. Decision-making skills, right? Using that evidence-based practice when we're making decisions. Being assertive, right? Remember the difference between assertiveness and aggressiveness, right? We want to be assertive and not aggressive. We also have to be empowering. And what does it mean to be empowering?
Being able to give a person the confidence to do their job, giving encouragement. I guess just like uplifting people, giving them like making them feel good when doing a job.
Awesome. Yeah, right. Helping them build that confidence, right? So that they can do something. Excellent communication skills. We also, as first line leaders, you need to understand ethical and legal aspects of healthcare as well, right? That's where, in part, that's where your Nurse Practice Act comes into play, and knowing what scope of practice is for not only you, but for those that you are supervising. Having problem solving skills, critical thinking skills, stress management. So, do you think nursing is a high stress profession? No, it's stress-free, right? Just like nursing school is stress-free, right? Uh, so helping to manage stress on the unit is also something that, you know, if you're working as a unit manager, you're working as a charge nurse, um, not only having good stress management skills for yourself and be able to manage, but also to help your teammates and your and other, you know, just other members that you're working with deal with some of that stress. So kind of having those skills is important. And then you will have to perform, just like Tevi was saying, you're going to have to do evaluations of your UAPs. And ensure that you are, you know, providing fair and unbiased, um, constructive criticism, when you're doing that. And so it's a lot. I mean, there's a lot that you know are responsible for, not only just with your client care, but working with other members of your healthcare team. So this slide shows the differences between management and leadership. And so I'm going to start with management. Management is the organization of all care required of clients. Um, and so the focus of management is planning and directing to meet the client outcomes, the institutional outcomes. They have their eye on the bottom line, right? Those day-to-day operations. They can value control, but should focus on collaboration. They are, it is a management is a formal role that is given to a person by the employer. They are appointed by their employers. Um, and then leadership is how a person empowers and develops a team so that we can meet and exceed the client and institutional outcomes. So the focus of leadership is to produce change, to meet the goals of the organization. They ask what and why, keep their eye on their future. They inspire trust. Leaders work in and on the business. But we also have informal leaders. What's an informal leader? Has anybody heard that term before?
Is it like a team lead?
It could be like a team lead,
Like you have a committee,
or
maybe like a skin committee to check wounds, and there's a leader of like that committee or something, like something that's specialized, and someone's delegated a leadership position in that specialty.
okay. Okay.
Kind of like a person who doesn't have any specific role, but they naturally have the qualities of a leader and people look up to them.
And people go to them, right? So somebody needs to mute, and I'm not sure. There we go. So it's like, you know, it may be the one CNA that's been there for 20 years and knows the ins and outs of everything, and, you know, knows all of the, you know, where to go to get everything you need and all of that wonderful stuff, right? And they may not be in a formal position of leadership, right? But they're that go-to person, right? If you need to get some information or you need to find something, right, they're the ones that you go to. So, you know, we also look at our informal leaders, that they are there as well. Then, you know, usually are always there to help. Leaders also need to influence others. So, you know, the overall goals of the organization. So a leader needs to be able to influence others. So they need to work, you know, they need to have those good people skills, the good communication skills, right? So that they can convince others, right, to implement and do what's needed to meet the goals. Um, leadership skills can be learned. You can learn leadership skills, but then it's through practice and experience that you really will develop your leadership skills. And so a lot of it is, I guess, trial and error at the beginning. What kind of leader do you want to be? And I'm going to stop sharing for a second. And I say that it's just kind of like the same as what kind of nurse do you want to be, right? Um, I'm sure everybody here has had at least one job in their life. And we've worked with people or managers or leaders that were awesome and fantastic. And I'm sure we've worked with some that were not so great, right? Everybody, I'm sure, has had at least one manager or supervisor that's not been the most ideal. And so you as future leaders, right, can take some of the good and the bad from your prior experiences and how you develop your leadership skills and how you want to lead people. Um, and it's a very fine line, right? It's hard sometimes when you have to lead other people because there's so many different personalities. Different thoughts, different behaviors that you have to work with. And, and it's a natural tendency, right? We want people to like us, right? That's just, something most people want people to like us. And so some people might go in a little bit too unassertive, right? And find themselves in a position where things aren't getting done like they're supposed to do, like they're supposed to be. And then they try to flip the switch and be more assertive, maybe even aggressive. And so it's just finding a nice little happy medium. Yes, Tevi.
I witnessed like an experience like similar to what you're talking about. As a STNA, I know a lot of us are already like aides or STNAs or in the healthcare, but it was a lady who I worked with. She was an aide for like 10 years, and once she graduated and got her LPN license, she became like the nurse to like the other aides that we all were like cool with. And you could tell like she was uncomfortable to delegate to us because like months ago she was an aide, like we were an aide, and like people wasn't taking her serious, so they thought she was being funny acting. So I just feel like it kind of ties into what you're saying. You have to be able to put your foot down or be comfortable speaking up because that's what you have to do as your job.
Right, absolutely. And that's a really good and now that's a really good example because that can be very difficult for, people that have worked in an organization and they have gone from one level to the next, especially from a CNA to a nurse. Because it is a different, right? Your responsibility as a nurse is different than your responsibility as a nurse aide, right? And so sometimes people will take that as, oh, she thinks she's better than us now, right? Because she's a nurse. And they may not take her serious, take them seriously at first. So that's an excellent point. That can happen, absolutely. And I just have to ask, what's an STNA?
It's a state tested nurse aide.
Oh, okay. I've never heard of that before. What state is that?
I'm in Ohio.
Ohio State Tested Nurse Aid. Okay. So I guess in another state that would be like a certified or a CN, like a certified.
Yeah, like a
nursing assistant.
CNA.
Okay. Interesting. I
Yeah.
had not heard that before. Thank you. All right, so before we go into the different styles, let's just reiterate these, okay? So again, differences between leadership and management. All right, leaders are people-oriented, motivating, they're focused on that vision and the strategy. They listen and empower. They're delegators. They are goal exploring, goal reflecting. Managers are more task oriented. All right. They're, they're for discipline, power control. They instruct others. They have subordinates. They're supervisors, and they're also more, they're goal setting and goal measuring versus that goal exploring and reflecting. And that brings us into the different types of leadership styles. Um, Oops, did I miss it? Or did I jumped ahead too far. So this is just more differences between the leadership and management, things that I've already talked about. And we talked about these roles, right? Preparing for that management. So talked about these already, right? We talked about having the basic nursing skills, the time management, right? We didn't talk about positive self-talk and thinking, but assertiveness, stress management, problem solving, your legal, your ethical, your communication skills, and your clinical evaluations. So that brings us to our leadership skills. So how many of you has anybody done like a leadership style inventory to determine like what type of leader they are? So those are fun to do. There's like little questions that you can ask, and it'll tell you what type of leader you are based off of how you answer those questions. So the three basic styles and that we're going to talk about are your autocratic, your democratic, and laissez-faire. All right. So autocratic are very concerned with the task. They're more of, I just, gonna give a command. You need to go do this, get this done. Your democratic concern, they balance concern with the task and the employee. So this is, if we're going to implement a new policy, we're all going to come together and we're going to get employee input into how we are going to implement this new policy. Autocratic would be, here's the new policy, this is what we're going to do. Laissez-faire, on the other hand, is more concerned with the employee. And so they're a lot more laid back. And when you look at leadership styles, everybody is going to change their leadership style based on the situation, right? So in most situations, a lot of times when we are working with people, we can use that democratic style of leadership, right? If it's a policy, if it's a procedure, if it's what should we do for Spirit Week, right? We're going to get information from the employees, right? We're going to accept their input and have everybody kind of make the decision together. So, but then there may be times where we, have no choice. We have to implement a new policy, a new procedure, and it doesn't, allow for employee feedback. This is just the way it's going to be done. So they can, become autocratic. And laissez-faire as well, depending on the situation. So a lot of people, a lot of leaders kind of just flow between the three styles. Which one of these would be, who would you want to work for? I'm going to ask that. Would you want to work for someone who is autocratic, democratic, or laissez-faire?
Democratic.
Democratic.
And most people like the democratic, right? Because then they feel like that they have a say in what's going on. So we'll start again. Here's your democratic. So Democratic, they share responsibilities and authority with the employees. They enforce policies, but still have a concern for the employee. They seek input from employees. They encourage problem solving. Goals can achieve they with positive staff feelings, right? Because just like you said, you would prefer to have a Democratic leader, right? So if you're able to give your input, right, you're gonna feel a little bit more positive. So these situations, right, these would be your daily nursing care situations, your meetings, committees, review of care plans. That would be, somewhere where we would see really good democratic leadership style. This is what I was talking about earlier. So you're a situational leadership. You vary your role to meet the demands of the situation in your work environment. Okay, so democratic way of leading is an effective way to get employee buy-in and to build team and get everybody on the same page because they feel involved. But when would be a good situation for that autocratic leadership to kick in? When is it where we just need to tell somebody what needs to be done versus getting input?
Maybe
In a
reoccurring
disaster.
problems.
Code blue.
Reoccurring. Ethel, go ahead.
When you have a code blue, everybody needs to get in position. You need to take authority.
There you go. Somebody else said disaster, right?
Yeah, it seems like it's more like for like the military.
Yeah, been there, done that one too. But yes, so an autocratic, exactly, in an emergency disaster situation, in a code blue, right? We don't need a democratic style of leadership, right? To say, oh, okay, what would you like to do? Would you like to do compressions? Would you like to do respirations? Would you like to go get the AED, right? It's more of, we need you, you call 911, you get the AED, right? We're going to start CPR, right? So that is where that's and just like in an emergency situation, a disaster, a hurricane, a tornado, an earthquake, and any of the other number of disasters that could occur. Right, that's when we need to have that autocratic, right? Somebody to just take charge and start directing people. So again, that's why I said a lot of managers, a lot of leaders, right? They will change their leadership style, meeting the demands of the work environment. So sometimes you can have that nice democratic organization where employees are, providing the input. And then sometimes you just need to take charge, right? And say, this is what we need to do. Let's get it done. And each one of those leadership styles, they all have their benefits. They all have, they're the good and the bad that are associated with them. And using a combination of all three usually leads to a pretty good, healthy workplace. So core knowledge and skills needed for leadership. So we talked about some of the things that, to develop your managing skills, some of the, knowledge base that you need to have. Core areas, motivate team members to accomplish team goals. How do we motivate people? What is a good way to motivate people?
When they do good, praise them and let them know they can keep doing good. Like if they were not confident about something, but they still did good or they got over something and was able to finally do it, praising them.
Okay, praise.
Incentives.
Give incentives.
Incentives, like a pizza party.
Or
I'm
Cash
kidding.
Even when they don't succeed in a task, you can always just tell them, hey, I know this didn't go the way it's planned, but we got it next time, and just keep building them up to motivate them to try to work a little harder.
I like that, right? Every negative conversation that you need to have with somebody, whether it's a CNA, another fellow coworker, even if it's something negative, even if it's a result that something went wrong, always start positive, right? Always give them a positive, like, maybe they didn't, I'm just going to use bed making. Maybe the bed wasn't made perfectly, okay, but they cleaned the room really well. All right. So you can say, hey, you did a really good job with Mrs. Jones' room. There was a lot of clutter in here and you straightened it up so she won't trip and fall. Right? Start it with something positive and then go, so let's talk about bed making, right? So we can kind of show them like, hey, you did something really well. Now we just need to focus on something that maybe needs to be worked on, right? Building people up is always try to find they always say, what is it? What's that? What if you can't say something nice, don't say anything at all? Is that how the saying goes, right? So try to find something positive, right, before we look at the negative. Communicate clearly, right? That is one thing that I even struggle with it sometimes too, because um sometimes it's like, how do I say what I want to say, or how do I explain what I need you to do? So communicate effectively, especially when we're delegating, right? When we're delegating a task to somebody else, we need to make sure that we're clear and concise with the information that we are providing and letting them know exactly what we need them to do. Problem solving. Okay. This is another ability that we need as effective leaders, is the ability to solve problems. And this could be problems, regarding policy. It could be problems regarding equipment. It could be problems regarding personnel, environmental, right? There's a variety of things that will come up as a problem, right? It's even like, you have a resident that is falling all the time, and you've done all of the traditional fall management techniques that you can do, and they're still falling. So we have to sit down and think out of the box, right? What are some things that maybe are not traditional, but we need to keep them off the floor? Collaborate effectively and build your team. So team building. Has anybody ever done any team building exercises within their organization? No, nobody's done team building exercises.
Yeah,
Does anybody, go ahead.
like, we do activities to try to, see the strength and the dynamics of our staff.
Okay.
So,
Okay.
see how much teamwork, they got. And then when, it helps,
Okay.
for everybody to take the quiz and participate. And those that don't want to participate, you could tell
Right.
that they like that team.
We've done something like that at a place I worked before. We made like an escape room in one of the hospital rooms. Like we had to work together to get out. So that was like something fun, but still in that nature.
Okay.
We
So
did
why do you
we
go
did
ahead?
something in a sort of where we took like the MAs and put them in the front counter, the front office people position, so that everybody can try to learn like the importance of having the people in the front of the office, showing just like it's different roles. Even when that person falls short, we still need to be able to fill in.
Okay. So it just helps people understand what everybody's role is, right? Because always, there's always going to be like, oh, Well, they don't do anything all day. They just sit there, right? But you don't always see what they're doing, right? You don't always know their role. Team building is something that I'll be honest, I think that in a lot of organizations don't necessarily um put a lot of stock in team building. And a lot of times you see team building is usually at the upper levels, right? You see it with the managers and the the upper level people, but we don't usually see it for those that are working, the units. And so, as a leader, as someone who will be working with, other nurses, CNAs, think of some ways that you can help build the team. I mean, it's not, it could be something as doing like, a bingo on a Friday morning with your team, or, just having a nice little, 10-minute huddle and just kind of addressing issues and just checking in and saying, how's everybody doing? Right? Is everybody okay? Or it could be just a 2-minute conversation with another, member of your team just to check in on them. So there's a variety of ways that you can do team building to help build your team. Teamwork is always the goal, right? We want everybody to work together effectively. And stress management. Stress management, I said it earlier, nursing is stressful, healthcare is stressful, nursing school is stressful. How do you manage your stress, right? What do you do? Is it working out? Is it listening to music? Is it deep breathing exercises? I'm trying to think of what else. Is it yoga? Is it taking a walk? Is it talking to a friend on the phone? And then so you manage your stress, and how are we going to manage the stress on the unit? What can we do when it gets really busy and, you're short-staffed and everybody's running in different directions, trying to get everything done, and you can tell that those stress levels are high on the unit. Think about some ways that you can, potentiate and try to prevent any stress related issues. Because what happens when we get stressed? What happens when we get stressed?
You don't do your best, you get burnt out.
You don't do your best, you get burnt out, right? Some people get grouchy, right? Or
Mistakes happen.
I'm sorry.
I said mistakes happen.
Mistakes happen, right? Things get forgotten. Shadia, what are some other stress management techniques that we can do? Or Lanisha, what are some stress management techniques that we can do?
Deep breathing.
Okay. Lanisha. Shadia, what are some stress management techniques? All right. So what are some things that we can do on a unit?
For example, say it's day shift, you could do something like a nice gesture that's not so expensive. I know we used to do like a coffee cart where our manager would bring in like coffee for us. That would help save time getting to work and save money. Like a little coffee bar. Um, Another thing, they'll keep like stress balls at the front desk. Um, During huddle, we can do like deep breathing exercises, stretches. We'll ask how somebody weekend went. What else? Oh, and prioritizing like taking time off to I don't know. I said enough.
Where I work, they have a respite care room where you can just walk off for like 10 minutes and get a break. just like decompress. If you're having a stressful moment, you can just go in there and sit in the dark if you need to, just to get a break.
When I
Yes.
worked at Children's Hospital, we had a lady, like she was like one of our child life specialists. She would come around and do like hand massages or like breathing exercises, stuff like that with us, like a couple times out the week.
So those are, yeah. So I know during COVID, which I know, of course, they waited till one of the most stressful times in healthcare, right? During COVID, they came up and set something else, like in the chapel, they did like a little meditation area with some of those what are those like the stress the little, what are those little rock, like, what is it called? The little rock gardens and stuff like that is what they are, where you can like rearrange those, and some other things. So, looking at, and of course, like I said, they waited till the most stressful time, but they put like inspirational quotes, prayer cards and things. And so, there are ways that we can help to manage stress. Sometimes you just need to sit back and count to 10, you know what I mean? And so, having, just, and then even what do you do? All right, so let's say it's a really stressful day, you're short staffed, and you have two CNAs that start arguing. What do you do then?
Separate them and try to figure out what the problem is by talking to them one at a time and seeing how you can prevent it from happening in the future. And but they also need to know that it's going to be consequences to whatever it was that started in the beginning.
Right. And so that's very important, right? You want to kind of separate them. You want to find out, but then you want to bring them together, right? And say, okay, what can we do now to fix this issue moving forward, right? Now we know not everybody is going to get along, right? Not everybody is going to be best friends. Um, but we need to work as a team, right? So that kind of goes with not only management of stress, but that also is your conflict management skills, right? That you'll develop as you go. So let's go ahead and take a break. Let's be back at 4:05. All right. So when we look at human needs, right? And so as leaders and managers, right, understanding human needs is important, right? So everybody knows who Abraham Maslow is, right? And his hierarchy of human needs. And so, we know that those physiological, safety, love and belonging, esteem, self-actualization, right? That nice little pyramid, that we've seen since probably day one of nursing school, right? Um, Meeting needs on one level acts as a motivator for meeting needs on the next level. And so as your needs are met, right, you're kind of trying to get to the next level. And when working with people, not just patients, but with, members of our teams, we have to understand that it's a human need. It doesn't matter if it's a patient or yourself or somebody else, right? We have to still meet to make sure that um oh, hold on, I'm sorry. Um, um, so when we're dealing with people that we work with, understanding that their basic needs need to be met as well, right? So safety is always going to be at the bottom of that pyramid, right? How are we going to meet their basic needs? Um, So when there's, difficulties, whether it's physical, whether it's emotional, um, you know, some regression, a goal is to try to get to the top of the pyramid, right? We all want that self-actualization, right? But, when we think about life, when things change or when things happen, right, we may have to go back down to that bottom level. So, think about this when you're working with, other members of your healthcare team. What are their living situations? What is their life outside of work? And we always say, leave your problems at the door, right? And that most people will always say, leave your problems at the door. Um, Sometimes it's difficult to do that, right? If you don't know where you're going to go home to, or if you have a home to go to, right? Or you don't have money to buy food for your kids, gas for your car, um, or even other, personal issues. And so when we look at working with others, right, especially as leaders, we have to understand who we're working with and what is going on with them, which leads to what their motivation is. Okay, so this is work motivators. Okay. So this is a little bit different. It kind of goes along with Maslow's hierarchy of needs. But this would be more work related, right? So level one, salary, benefits, working conditions, supervision, policies. So when you go to apply for a job, right, and you go in for your interview, what's always the thing at the back of your mind? How much am I going to get paid per hour to do this job, right? Because that's a huge motivator, right? You know, I'm going to come in and I'm going to do the job to my best ability, but I want to know how much you guys are going to pay me, right? Benefits too, right? So you may find this job and you really think this is going to be a great place to work, right? And they pay pretty well with that, hourly rate. But what if their benefits are like $1,000 a month, right? That's you have to pay out of pocket. That's a huge cut in that hourly pay rate, right? That you're going to get. So, but that is a motivator, right? You know, are there going to be benefits? So is there health care? Is there dental care? Is there vision care for me, myself, my family? What are the working conditions? Do you really ever know the working conditions somewhere when you just go in for an interview? No, you never know what it's truly going to be like until you actually get there and you start to actually perform the position. But, sometimes those first impressions, right? When you go in, you're like, oh, this looks like it'd be a nice place to work. And the policies of the agency. This level 2 would be safety in the workplace and job security, right? So safety in the workplace. And that's gonna vary about where you work. Then level 3 would be your interpersonal relationships. And then level 4 is recognition, growth, responsibility. And then level 5 is achieving advancement, right? Where do you want to go? And I would say under this level 1, especially as someone and, within the healthcare, I would also put in there, with benefits, are they going to pay for you or help you pay for you to go back to school, right? To get your RN, your BSN, your MSN, right? That would all kind of fall into those benefits as well. But motivation, then so we taught those are some of the mitigating factors when we're looking for a job. But motivation is a drive that causes us to set goals and behave in a way that will allow us to reach those goals. And there's both intrinsic factors and extrinsic factors when we talk about motivation. Your intrinsic factors, those are things that can either increase job satisfaction and contribute to growth. And so that could be achievement or recognition, right? And somebody said it earlier, and I apologize, don't remember who it was. I think it might have been Tevi who said, right, tell them they did a good job, right? If somebody's doing good, tell them they're doing good, right? Don't just keep expecting them to keep functioning at a high level without providing some sort of recognition, right? Even if, like I always had, little things in my office. I would have pens because nurses love pens, or candy, or just little like knickknacks and things to be like, hey, you're doing a good job. Here's a pen, here's a pad of paper, like whatever. Just I know it's like some really random stuff. I used to do rubber duckies as well. I have a thing for rubber duckies. I don't know why. But I always had like a variety of rubber ducks, and I would pass out rubber ducks too, just to be like, hey, you did a good job, right? Just recognizing people that they're doing good. Other factors, right? The potential for growth and advancement as well as responsibility. Not everybody wants to be a supervisor. Not everybody wants to be a manager, right? But some people do have that goal in mind, right? So it's all kind of just, it depends on the person. The extrinsic factors, those are maintenance factors or what we call dissatisfiers. These are things that decrease our job or increase our job dissatisfaction, decrease job satisfaction. Administration, supervision, salary, our interpersonal relationships, our work conditions, right? How many of us have worked in a place where probably not the best job in the world, but the people that we worked with kind of just made the job so much better, right? The people that we work with, the administrators, like everybody is great. It just may not be the best job in the world, right? I grew up waiting tables, right? And so some restaurants are better than others, right? But if we had a good team and a good leadership team, right, it just made it fun. You knew who you were working with, right? Everybody got along, and we kind of just work together to get it done, right? So intrinsic factors are satisfiers, extrinsic factors are dissatisfiers. So some of the job dissatisfiers, availability of equipment. So you guys have been to clinical. How many times, and it depends on, I'm going to say it depends on where you're working. How many times have you gone in and you can't find a working blood pressure machine or a thermometer or I don't know, something else along those lines that maybe isn't working, or an unrealistic workload? Staffing, we are in the midst of a huge nursing shortage, right? So staffing is an issue in many places. And I know you guys have done some clinicals in long-term care, right? Have you done so you see the staffing differences between the hospitals and the long-term care, right? It's a pretty significant difference, right? Why? And I often wonder, and this is just a personal thought because I love long-term care. It's always been a passion of mine. But I always wondered why they mandate the hospital ratios, but they don't manage the long-term care ratios. I always thought that was very interesting that they don't do that, right? So one nurse in a long-term care facility can have 40 patients, right? But one nurse in a hospital may have 4 to 6, right? And I get it. The hospitals usually have a higher level of acuity to deal with, their patients, but passing medications to 40 residents in the morning is not an easy task, right? Regulatory demands, paperwork. Nobody likes paperwork, right? So that's generally a job dissatisfier. So we can all look at places, you can look at places that you've worked or things that you've done previously, even if you're not working in healthcare now. You can see the good and the bad. You can even, either where you're working now, or you can go back and look at previous employment and see what some of those were. Yes, Debbie.
I've worked in both long-term care and hospitals, and I noticed how you just said that difference with the patient ratio, but I also noticed like at a nursing home or like a long-term care facility, they're like you could negotiate your pay more, or they'll do like bonus pay, or like it might seem like a lot because of the patients, but it's the same residents you keep seeing, so you kind of already know what to do and what to expect. So like it's like the pros and cons of that versus the hospital. Like they're not, I couldn't negotiate my pay with hospitals. I noticed that. Or like I had less work or less people at the hospital, like you just stated.
Mm-hmm. Yeah, and you're true. That is true. I mean, long-term care, they will offer bonuses, especially to pick up shifts and things like that. And it's true, you work with the same residents for the most part on a daily basis. I do skilled care, so my residents come and go, they come in for a couple weeks, then they go home, they come in for rehab, but still, though, I mean, think about it. And if you're passing medications to 40 people and each one of those patients has 10 plus medications, it can get a little bit hairy. Plus, you're still dealing with family members and, other things as well. It's just always an interesting concept to me. So how much have we talked about communication? How much have we talked about communication? I feel like we've done a lot of discussion about communication over the past few weeks. So just some hints with your communication. Especially when we're working with our CNAs or our nursing assistants, our UAPs, always be very clear, very specific. You're the role model for the nursing assistants. And so some of the things that we need to discourage, especially when we're looking at building teams, is discouraging the profanity, the criticisms, the gossip, the rumors. Use your I messages. You know, we've talked about I messages, right? You're taking responsibility for the message that you're sending. When talking with your supervisor, you want to be valued for the input that you are providing. Okay, so always, don't, try to, if there is an issue or a problem, right? Don't just bring up the problem, offer solution. Go to your boss and say, hey, this is what's going on the unit. This is but I have, this is an idea. I have, a potential solution. So it's not always like you're always bringing up bad news or, always bringing up problems. But if you bringing up the problems and you're offering a solution, that does help to take the weight off of them. Again, with your nonverbal, make sure that your body language and your message are consistent, right? So just always be aware of that. I know we've talked about that too. Written communication, this is something that even I know I need to work on this. I'm a very concise writer, and sometimes it can come across a little blunt, and I don't mean it to. It's just how I write. Always use language that everybody can understand. Always make sure that that you review your message, right? You read it out loud to yourself, you spell check, grammar check, whatever you need to do before you write it. What else? Do written work assignments. So that is one thing too that we always do. When you're setting up your assignments for your CNAs and more in the morning, make sure that it's written, that it's clear for them. That there's no changes, right? You can't just move things around as they want. On the phone, make sure I do this too, and I'll be like, why did I call this person? Gather your thoughts before you make a call so that you can kind of stay on task. And I know it sounds silly, and I don't know how many people have heard this, but smile when you're talking. I know sometimes that sounds a little bit crazy, but there's a difference when you're smiling and talking than when you're frowning and talking, right? There's a difference in the inflection in your voices. And try to, just keep your conversations to business, and, keep them short, sweet, to the point. And then always use your active listening skills. Your active listening skills, making sure that you're listening to them, especially when you're supervising people. You want to make sure that they know that you're paying attention to their needs. You don't want to show that you're distracted. You want to give them your full attention. You want to stay focused on them. You want to avoid judging them. And then, like I said, use those active listening, the rephrasing, the paraphrasing, the validating, right? So that you can make sure that you're hearing them and that you're providing the information. Let them talk. Sometimes, people need to just talk things out, vent, so to speak, as long as it's done in a professional manner. If you are open and you communicate with your staff, they're going to feel heard. That is also a way for them to feel empowered. And so if they feel heard and they feel empowered, right, they're going to do great. And it's just like us, right? It's just like you as a student, or an employee somewhere. When you have a want or a need, and somebody takes the time to sit and listen to you, right? That you feel better about the situation, right? At least somebody is listening to you. And respect, if something isn't right, we have the right to speak up, ask questions, identify problems, bring solutions to those problems. Nobody should feel uncomfortable Nobody should feel like they can't say or state their opinions. Again, as long as it's all done in a respectful way, right? That's how things change. That's how we make things better. And some of you I know are CNAs already, right? I'm sure that there's been times where like, this can be done a better way, or there's got to be an easier way to do this, right? Within the standard of care, and bring that up and say, I think we can do it this way better, and provide that feedback. Again, that's how we make change. That is how things improve. And so I know this kind of goes all over the place with the chapter, but so change of shift or change of condition report. Has anybody ever seen a change of shift or a change of condition report? What would that be? What would be a change of condition? Like, what would you expect to see? I don't know how to-
Is that like the 24-hour report?
That could be like the 24-hour report. Yes. So, so if we look at change of shift, our baseline report, right? A baseline is just like Tubby was saying, right? We work at, working in long-term care, you have the same clients every day, right? So, everything, for the most part might be the same day after day after day, right? And so you're just kind of giving the same similar reports. But then you may have that change in condition where Mr. Jones, all of a sudden, he stopped eating, he stopped drinking, maybe he's, got some other issues going on, right? So there would be a change. And it's usually a checklist of signs and symptoms. So what exactly is going on with Mr. Jones? And that is where we use our SBAR. So SBAR, situation, background, assessment, recommendation. What information do we provide in situation?
What brought them to the hospital? What's going on?
So my name is Jennifer. No. Right. So what is the situation? What's, who are you? Where are you? Why are you there? What's my background? What's the background information?
Like previous medical conditions?
Previous medical conditions, what their admitting diagnosis was, all of that good stuff. And then what is your assessment?
Their temp, blood pressure, lung sounds.
Right. So it's what's going on with them right now, right? So their vital signs, their lab results, their all of that good stuff. And this is what's different. And then what do we need? Do we need to send them to a higher level of care? Do we need to order some labs? Do we need to order a test? Maybe they need a different medication, a lower dose, a higher dose, whatever it is, right? And you're going to have all of that information ready to go. So when you call that provider, you can give them all of that information so that they can make a decision based off of the information that you are providing to them. All right, so this goes back to this stuff. So we've talked about stress management. We've talked about some of the things that we can do. Stress and anxiety can lead to dysfunctional job behaviors, okay? So it could be decreased performance, it could be negative interactions among staff, ineffective communication can be a dysfunctional behavior, high staff turnover, unhappy residents, families, providers, nursing assistants, right? All of those can cause, stress can cause dysfunction in your unit. So as a charge nurse, your job, right, is to control that stress on your unit. all right, and be that role model for your team. So you want to try to, one way you can do it is try to decrease the stress on the unit, which sometimes that can be a little bit difficult, right? But then when your CNAs are experiencing stress, you want to guide them and support them during those periods. And so that's why I always say, how do we deal with stress? How, you as a nurse manager, as a leader, as a charge nurse, not only are you going to have the stress of your position, of your, outside influences, but then you're going to deal with the stress of the people that you work with as well. And so this is, again, how you choose it. We always recommend positive coping mechanisms, right? Getting rest, going to, maybe walking around the block, listening to music, meditation, whatever it is that works for you. Find something that works for you. If you don't have any good stress management techniques, start practicing now, okay? And find something that helps you. Another thing too, and I don't know how many of you take breaks when you're at work, other than your lunch break? I'm not talking about lunch. Everybody gets a lunch. How many of you take like a 10 or a
I'll
15-minute
hide in the
break?
linen closet if I have to.
You hide in the linen closet. Okay. Okay. Jordan, where do you hide?
Normally, I'll probably go outside and just take like a 5-minute break, sit on the bench or something.
Okay. So yeah, I'm there too. I would go there. Usually there's some sort of like I don't know, like a little garden, that you can go kind of sit at, like, or on the bench, or like walk around the block, or trying to think of what else you could do. It was funny, Tevi, when you said when you said hide in the linen closet. When I worked in the restroom, and when I worked in restaurants, I used to go into the freezer and just yell because nobody can hear you in the freezer. So you
That's
can
funny.
scream and nobody could hear you. But yeah, I mean, sometimes you just need to like just let it out, right? And so that was always one thing. It's to this day, that's always one thing that I miss about working in restaurants is the freezer. So I could go in there and scream and nobody would hear me. But yeah, it's just, and then, your abilities to organize your shift, making sure that there's adequate resources for your staff, and making sure people take their breaks. I mean, everybody needs to take a break. It's, even the best CNAs and the ones with the best time management and the most positive attitudes, everybody needs a break, and we all have to take our lunch breaks, right? They're mandated. But everybody needs to take a break, and encouraging those breaks is super important. And create a calm environment, when it's just kind of like with those, with the communication techniques, right? When somebody's yelling at you, what do? You lower your voice, you stay calm, right? So, when everybody else is excited and running around crazy, right? Be the calm, right? Be the one that has the soft, gentle voice, right? To help kind of bring everybody down. And always treat them with respect. And this is something that I will tell you that I've noticed in healthcare, and that really bothers me. Every member of the healthcare team is important. Every role in healthcare is important. I love my CNAs. I could not get through a shift without my CNAs, and they know that. And it's simple as saying please and thank you, or I appreciate you. And I help my CNAs. I'll answer call bells, I will change residents, I will do all that. And if I have the time, if I'm very busy, they know I'm busy, then it's not like they expect it, but they know that when I'm not busy, that I will help them. So it's really it's about showing respect, kind of showing that you're willing to get down in the trenches with them. Because remember, as nurses, our job isn't just to pass medications, right? It's, we're still providing patient care regardless of the situation. So always just make sure that you let them know that you appreciate them. When we look at increasing awareness of irrational thinking, so irrational thinking can cause negative emotions, and that can result in stress. And so when we look at irrational thinking, this ABCD method helps us to, it's a way of controlling irrational thinking. So the book example is what I'm going to use here for this slide. So A is activating. So the book says, oh my gosh, wait, it said that a nursing assistant called in sick to work. Okay. Belief is the self-talk about the situation. So you get the call that, then the CNA is calling in sick, and you think that the nursing assistant has been out partying all night, and that's why they're not coming to work. All right. C is consequences. So, as a result of them calling in sick and you believing that they were out partying, right? You're abrupt with the nursing assistant on the phone, and she allowed herself to feel, angry about the absence, and it ruined her day. And now the nursing assistants are avoiding her. D is dispute irrational thoughts. So choose a more rational, assertive response to the situation, right? The nursing assistant called out sick because they had a headache. Avoid the judgments, right? Just, basically just accept, okay, you have a headache, you're not coming to work. Okay, thank you for letting me know. It is true. I mean, you will get to know, it's all about biases, right? We have to keep our biases to ourselves. And I know sometimes, just even in the position I'm in, when people call out sick, it does put a strain on other members of the staff, especially if somebody can't be, called in to cover. But try to avoid being negative when you're working with students. So, not students, with your staff, anytime somebody calls out, I always say, thank you for letting me know. I hope you feel better. That, regardless of what your internal feelings are, just respecting the fact that they're not coming in, and it kind of just saves space on both sides. So you want to kind of just, like I said, you want to avoid that negative talk. Some other ways to create a less stressful environment, organization. And so we talked about, an organization is, key in in leadership. So organize your shift. That helps to prevent some stressful situations. Things are going to happen regardless. You never know what you're working. We're in healthcare, right? You never know what you're going to walk into. And so, but if you have it organized, every day you do the same thing, you have the same schedule, the same way of doing things, right? It helps it to go much better. Making sure that the resources are available for your nursing assistants to get their job done. So linen is always an issue, right? Doesn't linen always seem to be an issue? Not enough towels, not enough washcloths, not enough sheets, or not enough briefs or wipes, or, time. Again, make sure they take their breaks, they create a nice, calm environment, and treating them with respect. So we look at problem-solving steps. So problem-solving steps are steps that we can use for anything. For there isn't enough linen on the unit, their blood pressure machine, the Dynamaps aren't working, we only have one working, whatever the situation is, okay? Get all the data that you need, right? How many Dynamaps are on the unit, how many are working, define the problem, right? Takes longer now to get the vital signs on everybody because there's only one working machine and there's this many patients. Set a goal, select your interventions, and then evaluate your plan. What does that sound like? What does this process right here sound like? Sounds like the nursing process, right? Collect, define the problem, set a goal, select your innovations, and evaluate, right? So if you're having trouble with a nursing process, one thing that I can say is you can use the nursing process for anything. You can use the nursing process for any part of your life. If you need to practice with it, just even making a peanut butter and jelly sandwich, right? If I want to make a peanut butter and jelly, I got to collect my data. What do I need? What's going on? I'm hungry. And you can use the nursing process. So again, kind of just when you're looking at solving problems, use that nursing process as a guide before you present information. Other knowledge and skills needed for leadership, occupational skills. And so, what are occupational skills? So occupational skills, documentation. What's the one thing we know about documentation?
If you don't document it, it didn't happen.
If it's not documented, it didn't happen, right? That is absolutely true. So very specific objective documentation, right? That helps us determine if that standard of care for our clients has been met. It also helps to make sure that we get reimbursement for our care, right? From Medicare, Medicaid, insurance, remember, there's a big push now. It's more about quality of care, right, than quantity of care. So we have to really make sure that we're providing that documentation that we are providing care. The legal aspects, this is going to be your Nurse Practice Act, your facility policy and procedures, the state, federal regulations, right, codes of conduct. All of those are there to guide our safe practice. So again, I can't reiterate enough, know your state Nurse Practice Act. Federal regulations too. There's a bunch of these, the Centers for Medicare and Medicaid services is a big one. They guide a lot of how we provide care to our clients. It provides a lot of information about how we get reimbursed for payment or reimbursed for care. Organizational skills, we know we talked about that. We need to have those skills to function. So time management, your CQI, your continuous quality improvement. So one thing as a nurse, as an LPN that you may be asked to do is sit on a quality improvement team. And quality in healthcare is determined by client outcomes. And client outcomes, just like when we think of the evaluation phase of the nursing process, they're observable, they're measurable results of the nursing activities that we are performing. And so CQI is everywhere. It's in hospitals, it's in long-term care, it's just kind of everywhere. And so you may be asked to work on a quality improvement project, or even trying to improve practices within the organization. And conflict resolution is another one that's going to fall under organizational skills. But some of the quality improvement components that we can put into, before I go there, that we can put into practice, making sure that your CNAs know what their job description is, encourage the nursing assistants to report safety issues, offer suggestions, And a lot of like your CQI is based off of the safety issues and other things that have happened, whether it was a fall or something else within, sorry, other, other issues within the organization, and we come together after the fact. We look at the situation and we try to decide on, better ways. So remember I said earlier about your resident that's always falling, right? You've done all those wonderful fall interventions, and they're still falling. So now we have to start thinking out of the box. How do we get them to stop falling? Yes, Tevi.
I had a question. I wonder if, I don't know if anybody else ever seen this, but you ever been working somewhere and they were short a CNA, so they'll make like one of the nurses be the aide for the day. Have you ever seen that?
I've done it.
Yeah, okay. I thought the place I work was weird, but they would occasionally do that. Like if they were short of aide, they didn't have agency, so they'll just have one of the nurses be an aide.
Mm-hmm. Yep, I've gone in and worked as an aide. We'll also, if we are short med techs, they'll have nurses come in and be the med techs. So yeah, I think it's fun. I like going in and working as an aide. I'm not gonna lie.
I know they're like prefer. They're like, hell yeah, I'll be an aide.
I can do this, bro. Yeah, I'll do this for the day. I'm not a problem with that. Other skills, anger management.
I have a question. Do they get paid as an aide or nurse?
They get paid as nurses. Yeah, they can't. Yeah.
As a nurse where I work at, they still get their nurse pay.
Yeah, they still get the nurse pay. I will tell you what, though, working as a CNA is harder than working as a nurse. I don't care what anybody says, but I think it's more fun because you get to interact more with your patients. That's the part that I like. Because you can just, you get to interact with them more than just here's your medicine, have a nice day, like kind of thing. So yes, anger management, and that is not just for yourself, right? We have to be able to manage other people's angers as well. But this is again, right, that assertive versus the aggressive behavior, communication and behaviors. You need to, do performance evaluations of your nursing assistants. And so, we want to make sure that we are objective, that we are providing feedback as soon as possible. We also need to empower our team members, encourage them to grow, as well as increasing their self-confidence and always be non-judgmental. I know that nurses go through nursing school, CNA go through CNA programs, right? Some people are just really, some CNAs are good at some things and not so good at others. And, they may excel in one area, but be a little bit weaker in another area. And that's just where you're going to provide education and growth opportunities for them. Maybe even offering some in-services so that you can increase their confidence as well as their skill sets. And then we get into the one thing that we really need to focus on is going to be delegation and assignment. So assignment is work that you normally do every day, right? So it could be, like your CNAs, they come in, they provide nursing care, they help with meals, they provide ADL care, they do so much, but whatever it is that they do, okay? So those are the activities that are part of their job description. It's their legal scope of practice according to the Nurse Practice Act, as well as, the education that they received in their CNA program. And you as the LPN are going to provide a supervision over that. Delegation is the transfer of a responsibility for the performance of an activity from one person to another, but you as the delegator are still responsible for that task to get done. All right. One thing too here is the person that you are delegating must agree to take on the task. If they say, no, I don't want to do it, then that's not an agreement, right? So they have to agree to do the task that's being delegated to them.
I was just gonna ask that, like, when is it okay to like not accept an assignment? Because I've turned down an assignment before because the number of patients they try to give me was just like unsafe, and I still kind of got written up. But instead of saying like, oh, she didn't want to do it because of it was unsafe or it was too many patients, they took it as I was arguing or I was being disrespectful with the nurse. So like I had gotten written up for that.
So this is different. Whoops. Sorry, I hit the slide. Assignment and delegation are different. So assignment, technically, once you clock in and you hit the floor, you've accepted your assignment. Okay. That is something that is, I mean, it's just something that is expected because it's just a normal what you do every day. Refusing an assignment is really, it just depends on the state. It depends on your organization. If there isn't another way for another somewhere else for you to go or someone else to take your spot, they really could get you for patient abandonment at that point. So I'm just gonna have an example. This was a long time ago. I think I was a brand new RN. So I had just finished RN school. I was working in the same facility that I was working as LPN. I'm sorry, same company, different facility. And so had like 2 CNAs call out. I worked overnights. And so the next morning, or when I think there was like 3 other CNAs, when they came in, I had handed them their assignments because the day shift nurse was running late. So I gave them their assignments for the day, and I had already redistributed all of the residents to a 3 CNA assignment, and didn't think anything of it. And next thing I know, the phone rings, and I pick up the phone, I answer the phone, and it's one of the CNAs, and she said, and her name was Jennifer too. It just happened to be Jennifer. And she was like, hi, this is Jennifer. She goes, I just want you to know I left. I said, excuse me. And she's like, I'm not working short-staffed. And I said, so my understanding is that they're already short-staffed and now you're leaving them even more short-staffed because you don't want to work short-staffed. And she said yes, and she hung up on me. And she ended up, I didn't do it, but she ended up getting reported to the Board of Nursing, and her CNA license ended up, or her license ended up getting suspended. Because she had already clocked in, got the assignment, and then turned around and left. So it was considered patient abandonment. So just be very careful.
Yeah, I feel like with my situation, it was night shift. And we do agency. So I had asked the supervisor, like, okay, I'll do a couple hours, but do you think you can get somebody from agency to come in? And it was 42 people. She wanted me to bounce back and forth from 2 floors. And one of the floors was memory care, so it was a lot of fall risk. So I just told her, like, no, because I had watched some of my CNAs, like, that I was close with lose their job from falls or um I just felt uncomfortable. So once a couple hours went by and I realized I wasn't going to get no help, and I was dealing with memory care that was combative, and then I was dealing with skills too, I just said no, I can't do it.
Yeah, I mean, safety.
But I see what you mean. That wasn't the right way to go about it. I definitely agree.
There's
So
other ways.
what if Tevi would have said she don't feel safe doing it?
Right. And I know, and that's perfectly understand. Like, I understand exactly, like, I'm not negating what her feelings at all. Like, it does sound like it was an unsafe situation. And I think I think that was a failure on both sides, right? I think that, there should have been, a little more conversation about the situation, and then trying to find some alternatives to care. Because we want the clients to be cared for, we want our patients to be cared for, right? And then with Tevi not being there, right, who's going to provide that care? So you have to look at both sides of the situation. I'm not negating Tevi at all, because I do understand like that could be a very unsafe situation, especially when you're going between two floors. So that was kind of it. It sounds like there's a more than just that issue going on with that facility. So we'll just leave that like that. So delegation, the information again, I know probably sick of me saying the Nurse Practice Act, okay? But you can find information about delegation in the Nurse Practice Act. Not every state allows LPNs to delegate. So you have to make, it's why it's important to understand what your Nurse Practice Act says. It's not required. And so what is required though, when you are going to delegate, is that you understand the scope of practice for your CNAs and your UAPs as well. And so, you can't delegate a task to them that's not within their scope of practice within that state. So like and we're gonna go, right here. So we talk about the 5 rights of delegation: right task, right circumstance, right person, right direction, and right supervision and evaluation. Okay, so right task. The task that you're delegating has to be within their scope of practice. It has to be something that they that they can do, that's within their scope of practice under the Nurse Practice Act, as well as within the policies and procedures of the organization that you're working with. The right circumstance, it doesn't require independent nursing judgment. So they are just going to collect the data. So I'm trying to think of a good one, like ask them, if you're going to have someone get vital signs. It's just getting numbers, right? It's getting the numbers, it's writing them down and bringing them back to the nurse. They're not interpreting, they're not making any judgments. They're just gathering the data basically. The right person, okay, making sure that we are giving it to the right person, that they're qualified to take, to do that process, whatever. I don't know how else to say it. Right direction and communication. So you're going to tell them exactly what you want to be done, okay, and what to report back to you. All right, so if you're asking them to get vital signs, right, they're going to go get the vital signs, and then you want them to bring those vital signs right back to you, right? Same thing, get a weight or whatever. Whatever the tasks that you're delegating, you want them to, whatever information you want to bring back to you, you want to provide that information. Right supervision and evaluation. So, excuse me. Delegation, you are still responsible for that task to be completed. All right, so I need, vital signs on 5 resident or 5 patients, and I asked the CNA, please go get the vital signs on these 5 patients. Well, maybe something happens and they didn't get the vital signs. You are still responsible for the vital signs to get done. Okay, so even though you're delegating the task to somebody else, you are still ultimately responsible for that task to be completed. So just be mindful of that, that you are going to still be responsible for that. I think that's like super low. So again, before you delegate, you must assess your patient. So you're going to gather data. You're going to delegate to stable patients. All right. CNAs and UAPs cannot delegate. So let's say I have two CNAs. I have Joe and Sarah, okay? And you ask Joe to go do the vital signs. Joe can't delegate that to Sarah, okay? Or transfer that to Sarah. It is Joe's responsibility, all right? So that's another important thing to remember as well. They can refuse to be delegated. Like Joe says, you ask Joe to do the vital signs and Joe says, no, I can't, I'm not doing the vital signs. And you can ask why. Okay. Why don't you want to do the vital signs? Maybe he's swamped. Maybe there's, something else going on, or somebody else had already asked him to do something. So you're always going to ask, they have to accept it voluntarily for it to be properly delegated. And we always use the nursing process. So these are some of the legal issues when it comes to delegation. Again, your Nurse Practice Act is going to be your guide, as well as the policies and procedures of your facilities. The stability of the client. If the client is unstable, you are not going to delegate that responsibility. Delegate to CNAs that have demonstrated ability. So in some state, in most CNAs in most programs, right, you're taught how to do vital signs. All right. But in that facility that you've worked at, they may not do vital signs. So maybe they haven't done vital signs, in a very long time, and they're not sure. You want to make sure that you're delegating to someone who has the ability to do what you're asking. Specific, objective, clear-cut directions. You want to provide assistance and instructions when you delegate. You're going to monitor them to make sure that whatever the task is that you requested, that it gets done, that they bring back the information that you requested. If something is being done incorrectly, you need to intervene. If you delegate improperly and a resident is harmed, you are liable, not the CNA. You are liable. So just be very careful. If you delegated properly and you were monitoring and the client was injured, the nursing assistant would be liable. Okay, so that's the difference. All right, if you delegate improperly and something happens, you're going to be liable. If you delegate properly, okay, and the client was injured, then there's potential for the CNA to be liable as well. And so I'm going to go some tasks that might be delegated, okay? Personal care, hygiene, dressing, toileting, grooming, feeding, hydration, basic restorative skills, so transfer, positioning, ambulation, range of motion, vital signs, height, weight, INOs, helping them with elimination, catheter care, fall prevention, hot and cold application, infection prevention, collecting urine and stool specimens. What we don't delegate, all right? So things that we do not delegate to our CNAs, complex sterile procedures. So nursing assistants don't have in-depth training in sterile technique, right? So no sterile procedures, no crisis situations. This is why we only delegate to our CNAs stable patients. Again, remember the initial education is always done by their RN. LPNs can reinforce teaching. Nursing assistants can collect data, but they're not trained to make decisions or interpret the data, right? So you just want them to bring back, the information. So that you can interpret it, you can look at it, and then decide what the next steps are. And again, anything you delegate, it has to be within their scope of practice under that Nurse Practice Act. And then, I know this is like the last little random part of this, but What are some things that you can do to increase your employment opportunity? I'm gonna stop sharing. So there are certifications that are available for LPNs. There's IV certification, there's long-term care certification, and actually for long-term there's an exam, not gonna lie. But for long-term care certification, I believe it's only 1 year of practice. So you have to have, I think is it 1 or 2 years? Yeah, I think it was 1 year of practice. You can do wound care certification. Anybody like wounds? I love wounds. I don't
I'm
actually
glad you asked that because is being an LPN, is it beneficial to have different certifications?
absolutely. It
Because
increases your job opportunities.
because to be honest with you, I don't never want to go back to school to become an RN, but I do want to pick up some different certifications, and wound care was one of them.
Yeah. I love wounds. I don't love the fact that people get the wounds, like, but if you have one, I'm all there. I'm all there. Um, but yeah, so IV certification, long-term care certification, wound certification, other things that will help you, seminars, leadership courses. Ooh, sorry. Um, Reading, especially like your nursing journals, keeping up to date with nursing practice, always bringing those recommendations to improve things, and networking is key, right? So, I mean, I'm a talker, I'm not gonna lie. But going and meeting people and networking, you never know when another opportunity and a better opportunity is going to arise just through that process. So, kind of, work your way around. Nursing, it always seems like there's a lot of nurses out here in the world, but nursing is really a small community. And so, meeting people, getting to know other people and what they're doing and the jobs that they have can be beneficial to you as, as you're looking for maybe some other opportunities within, within your scope. So networking is clearly, I'm sure everybody knows, people that work in other places other than, where they work, right? So, really kind of just looking at some of those things. I'm trying to, all right, so for some reason my book isn't working. So I'm going to pull up some delegation questions as soon as I can get it to work. I don't know why it doesn't want to work very quick. But does anybody have any questions? No. Hmm. Why is this not? Ah, there we go. Let's see. All right, we got time for 10 questions. All right, I'm going to share my screen. So you can say the answer or you can put it in the chat, either ways, but I want as many people to answer as possible. So can y'all see the question? All right, so we have a patient that has a tracheostomy. Which duties can the nurse safely delegated to assistive personnel? It's a select all that apply. see. 1, 2,
I would
3,
say 135.
1, 3, 5, 1, 3, 5, 1, 2, 3, 5. Okay. So we got 1, 3, 5 for sure. 1, 3,
But yeah,
5.
not two. They can't instruct them.
Correct. No education. Good jobs. All right. So I'm going to hit submit. Let's see what we did. It's correct. Awesome job. So yes, they can hold the tracheostomy tube while you're changing the lines, right? That just, it's having an extra set of hands so that we don't, if they cough or whatever, it doesn't pop out. They can gather the supplies and they can assist in delivering oxygen before and during the sterile suctioning. So awesome. Good job. All right, let's see. Next question. The charge nurse is delegated reading the labs of a patient with COPD to a float nurse. Oh, this is interesting. The patient has the following ABGs. The float nurse is unsure if he should take any further action based on the ABGs. Which course of action should the charge nurse suggest? Oh. All right, need a couple more to break the tie here. All right, we're gonna go with, I think it's 3. I think we got 3 as the winner. Continue to monitor. So normal ABGs, 7.35 to 7.45. So his pH was good. His
Always gonna be kind of low for a COPD patient anyway, or not low, but
right. Why? Because what happens with COPD?
oh my gosh, they breathe abnormally anyway.
Right. Because what is their trigger? What's their trigger?
Yeah, they're
Right.
using all
So
of their
remember,
respiratory muscles.
yeah. So it's with COPD, right? Your emphysema, those things, right? They get used to the higher levels of CO2, right? So good. That was good. I mean, that was good. You guys deduced that that's awesome. All right. So the nurse has delegated all the personal care of her patients to the assisted personnel. Which of the following situations would warrant the nurse to give additional guidance? Oh, this is a good one. I think we got that one. So let's see. Very good. Yes. I was trying to figure out what a 120-degree angle was. I was like, wait a minute, I must be looking at this wrong. But yes, right? So COPD, we're going to put them in a Fowler, semi-Fowler position, definitely not at a 120-degree angle. Good job. All right. So now we have a post-op client that had a tonsillectomy. Vital signs upon return to the unit were temperature 37, pulse 76, respirations 20, blood pressure 134/72, and he's setting at 98% on 2 liters of oxygen and has remained stable for the past hour. Which post-operative duty should not be delegated to assisted personnel? All right. Very good, right? You're not assessing, we're just giving them a task, right? They can assess, they can just bring it. Awesome, good job. All right, the nurse and an assisted personnel are assigned to care to a patient on mechanical ventilation. Which action should the nurse delegate to the assisted personnel? All right, it looks like the winner is 4. So 4 would be assist the respiratory therapist with obtaining an ABG. So we can't assess, okay? We can't evaluate. All right, cleansing and reapplying a dressing should be done by the nurse only because we need to be able to assess that wound afterwards. So they can assist the respiratory therapist with obtaining an ABG. All right, another select all that apply. The nurse is caring for a post-op patient who underwent surgery for placement of a porcine valve. Which instructions should the nurse give to the AP regarding post-op care? What's a porcine valve?
Pig ventricle valve.
It's a pig valve, right? So in the heart. So they've had a valve replacement in their heart. So what can we potentially have the AP, the assisted personnel do for our patients? One, two, three, 4. 1, 2, 3, 4, 6. So we got 1, 3, 4, and then we potentially have a 6. I think I got all the answers you guys gave me. Okay. Uh-oh, what did we do? Oh, I missed 2. My bad. I'm sorry. I'm sorry to all the ones that put 2. I'm sorry, that was my fault. But yes, we missed the 2. So 1, 2, 3, 4, and 6. So absolutely. Use a soft bristled toothbrush when providing oral care. Chart the INOs. Observe for and report obvious blood on the surface of the dressing. Report any complaints. And then remind them to turn and cough or to cough and deep breathe every 2 hours. Absolutely. Only thing they can't do here is apply that O2. All right, number 7, which instruction would the nurse give to the assisted personnel about caring for a patient who has altered mental status during the post-ictal phase of a grand mal seizure? Oh, all right. So we got 1, we got 4, and we got 2 are the potential. And I think 2 has got the most. So we're going to hit 2. Very good. So You can assist them in the AP can assist them into the sideline position and encourage rest. They will be tired. They're gonna need to rest. And so observing, report, and document the return to baseline is outside of the AP's scope of practice, right? All right, the patient is a Glasgow Coma scale of 8. Which instruction should the nurse give to the AP? I'm trying to count. So it's a toss up between 4 and 2. Let's see. Trying to see who's got more. I think 2 has more. So I'm gonna hit 2. 4, identify and explain, or 3, identify and explain everything you do as you are doing it. They're in a coma. A GSDS of 8 means that they're in a coma. And so remember, hearing is always that one sense it's going to kind of stick around. All right. So always, you still want to talk to them. You still want to tell them what you're doing, identify yourself. All right, in caring for an unconscious patient, which instruction would the nurse give to the AP about positioning the patient? How should we position unconscious patients? The hard one. Sorry, my dog is whining. All right, this one, it looks like 3 is the lateral recumbent, sorry. I don't know, I always say left for some reason. And that's just lateral is to prevent aspiration. And then the last one, which actions can the nurse safely delegate to assisted personnel when caring for a patient at risk for pressure injury? Select all. All right, so we know 1 and let's see. Weeks, lots of 2s, lots of 4s, and lots of 5s. Excuse me. Very good. 1, 2, 4, and 5. So absolutely. Turn and reposition every 1 to 2 hours. Check and record their vital signs every 4 hours. Help them to the bathroom. And then, of course, remind them to sit up in a chair 3 times a day, right? That was awesome, you guys. That was great. You guys did awesome. Good job. Yay. Awesome. Did these help? Okay. I know I probably asked that. Oh, hello, baby girl. I know I probably asked that the last time I did this as well, but I just want to make sure.
Did you find those in Evolve?
I did, yes.
Is it under delegation?
No,
Or-
this is my book. This is my
Oh,
book.
okay.
Yeah. This is one of my books. But I found it and I thought maybe it would help to give some practice questions. So